A new government report finds the use of dietary supplements is on the rise, and half of all adults in the U.S. popping vitamins and minerals cost about $26 billion a year. But do they actually make us any healthier, or is a lot of this just hype? Medical correspondent Dr. Jennifer Ashton is here. She's got some answers for us this morning. Doc, good to see you this morning.
Good morning, Chris. You too.
So how much is there to it? I mean, are they making us a whole lot healthier?
Well, this study is about who's taking what, and no surprise, we take a lot of vitamins and supplements in this country. About half of Americans take them every day. Big ones, calcium, vitamin D, some supplements. The question of whether or not they're making us healthier, actually the data is conflicting. Some say yes, some say no. There's no question, ideally, we should get these ingredients from our diet. But you know, as well as I do, the American diet is really lacking. So probably the people who need these supplements most are usually not the ones taking them, unfortunately.
You mentioned a couple earlier. What are some of the most popular supplements people are taking?
Probably the biggest one is calcium, and we see about 2/3 of women after menopause, which is around the age of 50, taking them. Vitamin D we hear a lot of. And then there are all kinds of other supplements that people really need to remember. They need to talk to their doctor about these ingredients, because anything that's found on a shelf, you don't need a prescription for it. That's what people are usually drawn to in terms of taking.
Now, the study said that women take more supplements than men do. Are there any supplements that women definitely should be taking?
There absolutely are, Chris, and probably the biggest one is folic acid. For a woman of reproductive age, you have to remember, in this country, half the pregnancies are unintended. That doesn't mean undesired. Now, when you talk about folic acid, women of reproductive age need 400 micrograms a day, and you need to have that in your blood system months before conception to prevent neural tube defects. So that's probably the most important one. And then calcium, young kids, teenagers, women after menopause, very important as well.
Strong bones.
That's right.
Like you said, you don't need prescriptions for most vitamins and most supplements.
Correct.
But what do you need to be on the lookout for?
Well, listen, we tend to think in this country, if a little is good, more must be better. Not true. These vitamins can have toxicities. They can interact with other drugs. If you're going to take a vitamin or a supplement, you want to look for something called a USP label, which is usually stamped on the more reputable brands of vitamins, really tells us about the purity and the quality and the content, so you know that what in fact is on the label is actually in the pill that you're putting into your body.
We all want to take pills like this to make ourselves healthier, but is this the best way to go?
Well, probably, again, you want to get it from your diet. If your diet is lacking, sure, in moderation, these supplements can be very good. You want to have a nice, healthy lifestyle, but most important thing, if you're going to take these, make sure your doctor knows about it.
And as far as storage and shelf life?
Not in the places most people put them. Not in a moist bathroom, not in a hot kitchen. So you want to keep them in a cool, dry place. A lot of those plastic containers, very helpful, and they don't have an unlimited shelf life. They don't last forever.
Exactly. If you're going to take them, they may as well be the right ones, and they may hopefully be working.
Exactly.
Dr. Ashton, good to see you. Thank you so much.